Hey, everybody, welcome back to the Monday Afternoon Journal Club. Ed Bauter and Dan Schwester here from the Overrun. Danny, this week we're going to talk about whether or not air medical transport saves time and how to improve survival with the time we have. This is from
Of
Boland
course
et
they do.
al.
Helicopters are cool. Do more helicopters.
Absolutely, they're the best ones. This is from Boland et al. This is out of Pittsburgh in the Journal of Trauma and Acute Care Surgery. There's so many things to like about this data set, Dan. The biggest thing, so the end
I
of
know
this
you
study,
love. I knew when I got this, I knew you loved it, and I'm just going to let you love on it.
It's so good. So what they did with this was really interesting. They have a sample of 280,271 patients.
Yeah.
And they looked at survival advantages with air medical transport. And specifically, is there kind of a time, right, where this time saved or whatever improves outcomes? Because we've always talked about using air medical transport where you want to get them to the hospital faster, right? Get them to definitive care faster. But what is faster? Right. You and I live in a state where we have a lot of really good and accessible high-speed roads. So, every trauma center is off of one of those high-speed roads. So how much faster are we going to get there? And
There's two things also to add in with this. Number one, we work in a place where our scope of practice and the flight medic scope of practice is basically the same. That's another big issue here. It's, in a lot of states, when you're handing off your patient to a flight crew, they've got a significantly expanded scope of practice. That's not the case with us. We basically do the same things that the flight medics do. Again, not for the purposes of this article, but just pointing out some things.
Yeah, and every system is a little bit different, but what's good with this, and this is why you want to have the larger sample size, is so you can kind of generalize it out to a larger population. But one of the most important things they found here was patients that met physiologic or anatomic trauma criteria, right? The National Field Triage Guidelines. If you could save about 13 to 17 minutes getting that patient to the hospital using an air medical unit, that improves survivability. So that's our number.
They found the sweet spot.
Right. And
so what they found the number that works. They found the number that works for the most amount of people, that if you can cut it off, if you can cut that number off, you're going to do good for your patients. If it's higher or lower, you're not going to see a benefit.
And we love us a good infographic here. And this is one of the best ones I've seen in a long time.
Right.
So what's great here, because if you can't read words, understand pictures, and Danny and I are picture lovers. So
make infographics great again.
So in this, the population, they looked at patients who were transported more than 40 miles by air or ground. Now, again, this is something that you might not be able to generalize to your system. It has been a long time since Danny and I have transported someone over 40 miles. But given that, in this population, patients that were flown had better outcomes after that 13 minutes. Now, another interesting thing here is if you had patients that did not meet field triage guidelines, no amount of time saved was associated with survival. So there's a positive and a negative to this, right? Which is to say that if you over triage your trauma patient, right? There was this big line for years, I think it was line 16 or something like that, in the triage guidelines that always said provider judgment, right? And we would always add that. We're like, you know what? I think just the little extra safety, right? I think this injury is a little bit more serious than ground, so they should go by air. No improvement in outcomes based on those little things. So they have to have this. They actually have to meet these field triage guidelines. And then again, figuring out how much longer it's going to take to get them to the hospital, either by air or by ground. So in our setting, Danny, this is something that is a little bit complicated to apply to our practice, because more often than not, we're less than a half hour from the trauma center. Now,
absolutely,
this paper talks about 40 minutes, which is a good number because most places use that 30-minute standard. So knowing that we have, if we're going to save 13 to 17 minutes, then this patient can probably benefit from an air medical transport. Now that we know this, I guess, how can we start rolling things into place? How do we avoid doing math on scene, I guess, is the big question.
I don't know offhand, but I can tell you for our area and places like that, which is suburban area of a major metropolitan area, we have multiple trauma centers within less than an hour of a drive. I'm going to say this, for most of the people, if you're within 30 to 40 minutes of a trauma center by ground, you don't need to fly unless that flight service provides something your patient needs you can't give. So I have RSI, but I don't have blood. But if I have somebody
Mhm.
who needs blood right away and is dying from hemorrhagic shock to the point where I don't think I'm going to make that 20-25 minute trip, that's a valid
Yeah.
reason in my mind to call for that helicopter to get that blood on board. That being said, I think we really have to recognize that air medical has a benefit for a very narrow subset of what we do. For the most part, our scope of practice is well equipped to handle traumatic injuries nationwide. I think, we know there's an increased risk to the crew, to the pilot, to the patient when we fly them. If you're, it's like Kevin always said, like, hey, if your tire blows out while you're driving somebody to the trauma center, you can deal with that. If your engine blows in the helicopter while you're transporting the trauma patient, you're a brick.
Right.
Um,
Yeah.
and it's a very, very important point. It's a significantly increased amount of risk. It's a significantly increased amount of effort that needs to be done to fly a patient. It should never be a willy-nilly decision just because, hey, we're far away. Hey, we're 30 minutes away, call the bird.
Mhm.
You need to really look as a clinician. What does this patient need? What can I give them? And what does this benefit? Because if you
Right.
can't answer those questions, they shouldn't be flying. We shouldn't be putting our friends in danger. And I just think that for me, I haven't flown anybody in quite a while. I don't anticipate flying them
Yeah.
unless, they're entrapped, they need blood, they need something I can't provide. Are they going to fly a trauma surgeon to the scene? I'm on board. Absolutely.
Yeah. And
If
this
it's
is
just
something,
me and my partner, I got it.
yeah. And we're in a state where our air medical units are kind of oversaturated. I think there's
Yeah,
14 in our state right now. Um,
for now.
what this tells me is it tells me like I'm coming up on a motor vehicle accident,
Mhm.
right? Where you come up on the scene and it's just one of those big sexy accidents where the car looks like a can opener got taken to it. That's something we're like, all right, put an aircraft up now,
Mhm.
right? Like seeing this data set, like, all right, I know that if I'm going to save 17 minutes, this
Mhm.
patient their outcome might be improved. Extrication is going to take 10, right?
20.
So yeah, right. So now, given that setting, all right, let me put an aircraft up. Let me get them on the ground so I can just take that patient out, put them in the aircraft, get them to the trauma center faster.
Sure.
For me, this paper kind of hits that sweet spot,
Yeah,
right?
I agree.
Where
I agree
and
100%.
it's a very specific kind of niche, patient presentation, but having to do that, the logistical math, right? Of all right, I know that I was dispatched from a trauma center and I've been responding for 20 minutes. And
Yep.
now I've been on scene for 10 minutes. All right, it'll take me 20 minutes to get back and the patient is
Mhm.
still being extricated. Great, this is someone who can fly. And what this also supports to me is you get to the patient who your hip fracture, right?
Mhm.
Your long bone fracture, those kind of things. Those patients can probably go by ground because again, there's not a huge survival benefit to going in the AMU. This isn't to take away from, we're not trying to take toys away, right? This isn't like I'm going to take away your
No.
helicopter and all that stuff, but it reinforces that we have these tools available to us that have to be used in the appropriate way. But let us know what you guys think. Are we flying people for less than 17 minutes, and what are our survivabilities and outcomes looking like? Check out all
Mhm.
of our stuff here on YouTube. Subscribe down below. Check us out on EMS1 and at overrunems.com. And for the Monday Afternoon Journal Club, Ed Bauter and Dan Schwester, and we will talk to you all next time.
Fly safe.